Hello, I'm delighted to be talking to you again in what is my final staff video as interim CEO. It has been a privilege to serve as your Chief Executive Officer over the last 5 months, and I have very much enjoyed the experience. I want to thank the board of the HSE, my executive management team colleagues, and senior colleagues across the services and within the department for their support over this period. I particularly want to acknowledge the significant efforts of all of the staff across the wider health and social care system, including our GP, private nursing home, private hospital, and voluntary organisation colleagues. I've had the privilege to visit many services during the past few months. It has been an honour to meet so many staff and service users and talk openly and honestly about what's working and what we need to improve on. In particular, the experience over the recent winter months in terms of the impacts on patients and staff due to the unprecedented pressure on health services arising from the levels of respiratory virus circulating at the time and the intensification of our visits to provide support to sites has provided further evidence of the need for a sustainable programme of strengthening and improvement in our health and social care services. As we know, this requires sustained investment in additional capacity and the structural and other reforms set out in Sláintecare. But my sense is that this is necessary but not sufficient. I believe we need to fully adopt a management method or framework, which we don't currently really have, that one, truly puts the individual patient first in every aspect of every decision and every action at all levels of the organisation. Two, is focused on identifying and eliminating over time all forms of waste that are of no value to patients or service users, including waste of staff skills and waste of staff and patient time. Three, a method that adopts systems thinking and operations management principles and techniques so that we gain efficiency and effectiveness and remove waste without asking staff to work harder, faster, or longer, and without reducing the important direct contact time between clinical staff and their patients or service users. Instead, we need to constantly examine our processes and re-examine them in a very deliberate and structured way that involves patients, service users, and staff at all levels in continuous incremental improvement. And finally, four, a method that has as one of its hallmarks that management at all levels, including senior national leaders, are very visible and present out at the front line each week. There are practical examples of where this has been done successfully, albeit it is clearly a long-term effort that requires sustained focus at every level of the organisation. I have recently shared relevant reading material on this topic with senior leadership colleagues across the system. I hope this can serve as a starting point for a necessary conversation over the coming months to see if this provides us with a way forward as we move to implement the new regional health areas under Sláintecare. As you know, Bernard Gloster has been appointed as the new CEO of the HSE and is due to take up the position on Monday. And we are looking forward to working with Bernard to improve services for our patients and service users. I know you will join me in welcoming Bernard and wishing him every success in his new role. Finally, as I record this message, Wednesday's serious fire at Wexford General Hospital is rightly in many people's thoughts. This was and still is a difficult time for patients and for our staff. I want to commend the work of everyone involved who have managed the initial stages of this crisis so well, particularly the local hospital staff and management, the area crisis management team, the wider community and hospital services, the HSE National Ambulance Service, and our colleagues in the fire services, in the local authorities, and in Garda Síochána. Thank you for listening.